dear friends, dear colleagues. Today I'm very happy to introduce Dr. Pierre Mainil. He is a pathologist from Switzerland, and happily he is now in Kiev, in Ukraine, and by his Aginko Foundation, he supports cancer diagnostics in Ukraine. Welcome.
Thank you for having me. I'm happy to be back in Kiev and in Ukraine. It's my 7th trip after the start of the war, totaling 53 trips in Ukraine totally.
So you are a fan of Ukraine?
Yeah, I'm becoming Ukrainian one day.
Okay.
It's because of the people in Ukraine. They're very interesting.
Okay, very nice. Today, I want to ask you, and starting from very beginning, I want to ask you how to improve the pathology in Ukraine, how to improve cancer diagnostics and treatment and everything. But I want to start from asking you a very simple thing. How to become a pathologist in Switzerland, in European Union, in United States, Tell us something, please.
I mean, it's a pretty standard curriculum. Usually you start as a medical doctor, you make your medical studies, and after you go into the specialty of pathology, which takes between 5 and 6 years, depending, or 4 to 6 years. And then you work as a resident in a hospital or an institute where you learn pathology. After you become, I would say, a pathologist, and after you start to practice pathologists in different institutes, but it takes a long time to become a good pathologist because pathology is about exposure, it's about seeing case, it's all about it.
So it's like you need to fly hours to get a license. So
you get your license, but you can start to fly little planes, and then you get to the big planes, you have to be the co-pilot first.
Okay, very interesting, very interesting. What is the life of pathologist? What does he do?
But pathologist, he does diagnostic, he also does cytology, so he receives samples, he prepares the samples, or they get partially prepared for them, and he makes a diagnostic. And after the diagnostic, he communicates the diagnostic to the clinician or to the various boards of clinicians to decide about the cancer treatment. So he also decides what further analysis needs to be performed. So a pathologist is not to look at the slides and to say what it is. In most of the case it is, in 90% of the case it is, but in the 10% of the case it is where the real science starts, and he has to communicate with the different doctors.
I think it's completely different from what we have here.
I don't know, but I think a pathologist needs to communicate to the clinician.
Yeah, I'm sure about that, but I got you. Tell us, please, what are the biggest challenges for pathology now, in Europe especially, in Ukraine? I think you see everything from...
I think the major challenge all over Europe and all over Switzerland, even including because Switzerland is not belonging to Europe, is the number of trained pathologists. There are not enough pathologists able to serve, I would say, the number of diagnostic. And in Ukraine, it's even worse because by my many trips in Ukraine, I realized that not all the pathologists are performing biopsies. Many also do post-mortem autopsies.
Yes.
And therefore, you don't have the full, I would say, arsenal of pathologists doing biopsy. So basically, you have also the pathologists also involved in the war. So you are really lacking pathologists. You're missing 2/3 of your pathologists. If you look at the map of Europe, and the density of pathologists in Ukraine is extremely low, and in other countries is also very low. Interestingly, the density of pathologists in Russia is quite high, but I don't think Ukrainian patients wish to have Russian diagnostic of cancer.
But how it's possible?
I think because it's academic careers a lot. A pathologist is more, I would say, there are two types of pathologists. There are the pathologists, they never speak to the doctors. They stay in a room with their microscope.
I thought they are also
No. They are also communicative pathologists, that integrative pathologists, that also speak to the clinician, etc. And this is the new generation of pathologists that we have to build in. The real pathologist is not looking at the slides, is thinking about what happened to the patient. I have the beauty to have done clinical medicine before pathology, so when I see a slide, I think about the patient. Which is nicer.
And which we have to implement here.
Yes.
Okay, thank you much for this explanation. I actually never thought that a pathologist should communicate and decide strategic treatment options, yeah?
Yes.
Okay.
Which makes the job nice.
Okay. Yeah, I know.
And therefore, more challenging.
Yeah.
Because you want to make sure that what you give is true. And you have to be able to doubt of your own diagnostic, is why second opinion is important.
Let's talk about second opinion now. But before we go to second opinion, you are saying that currently we are lacking pathologists, physical people.
Yes.
But from my side, I know that in Ukraine, 70% of the time, pathologists are just writing papers.
What do you mean writing papers?
Paperwork. They are overloaded with paperwork.
Okay.
At the same time, I know that now we have maybe less pathologists, but we have computers, we have large language models, we have AI. I don't believe it. So why we are lacking people so much if we have very new technologies? And while still in Ukraine, doctors do physical paperwork.
I will answer, as an anthropologist.
Anthropologist, okay.
My professor of pathology was telling me that a pathologist is nothing else than a smart gorilla. Because gorillas in the jungle, they find their way and what to eat by a pattern recognition of what are the leaves, how the leaves are. A pathologist do the same. He look at the slides, and from the pattern of the slides, he make a diagnostic.
Okay.
This is pattern recognition. AI do the same. They recognize the pattern. Pathologists shouldn't be worried of doing administration. The system should support them to do the administration and all the computer system. He should focus on doing diagnostic and not doing administration. Administration should be done by administrators or done by computer systems that facilitate the life of a pathologist. And the focus should be doing diagnostic pathology.
Okay.
And if they have too much time, then they need to spend time to read and to become a better pathologist.
Interesting. If you are a student in Switzerland, medical student, do you still physically look the glasses during your education?
Yes, we do.
You have to.
And also in pathology as a training.
My son is studying medicine now.
Yes.
And he showed me the glass light that they have on their university. And you know what? I was studying and I had the same glass. Yeah. It's manufactured, I think, in 1970s.
I still have my collection of slides from the university where I was studying pathology. But anyhow, it's getting more and more digital. It's not a way to go to still have the glass slides.
We still have to teach them to look.
No, many universities switch to digital,
So students have no idea how to use microscope.
Yeah, they still have some microscope. They have an idea. But, they already started at 12 years old in the school using a microscope. So it's enough. The microscope will be removed from the laboratory one day.
And it will be changed by digitalizing platforms, yeah?
Yes.
I got you. tell us, before we go directly to second opinion, tell us please, I believe in European Union, in Switzerland, you do all digital, then second opinion probably is easy.
No.
Which part is no?
There is no full digital, neither in Switzerland, neither in European Union.
So it's a myth.
It's a mixed, and it's still a
myth. Myth, like
it's a myth.
Oh my
yes,
God.
no.
And like what percentage is digitalized? Or it's not by percentage, maybe?
Yeah, you can. I don't know. My own estimate would be about 15% digitalized. The rest is not.
Less than 20%?
Yeah, around 20%. But I don't take those numbers right.
So it's not half?
No, it's not half. It's
Wow.
not half. And coming back to the problem, the major problem of pathology is the lack of pathology. And they are dying.
Pathologists.
Pathologists.
Okay.
And they are dying out. They're getting old, you know.
Why?
Because
they should be replaced by new.
The numbers of new pathologists replacing the old are not enough.
Why?
Because
they are not paid enough?
No, it's not about the money, it's about the training of pathology. There are not enough people learning pathology. So it's why, if you look even the number of Germany, there are not enough new pathologists replacing now the generation of pathologists between 70 and 75 years old.
Wow.
That will go to stop pathology. So,
We have nobody to replace them.
we have nobody to replace it. So the workflow, the pathologist needs to be more efficient, see more case, or replaced by AI. So at the end of the day, it won't be a choice. It will be a reality that AI will replace the workflow in pathology by the lack of pathologists.
So we give simple cases or...
No, but the problem is, what do you do when you don't have enough pathologists? You need to find solution. The patient can neither wait for a long time.
But how can we believe the machine? We have to have somebody's signature.
Of course, but the AI is a support of...
support.
Is a support of diagnostic. It helps you to classify your case and prioritize your case to be more efficient in your course. So this helps. But at the end of the day, even with AI, we need to train more pathologists.
Anyway.
We need to make the profession more attractive. The quality of life of those.
Money?
Not only about money, about the quality of life.
Okay.
About being able to work from home. About to have, a woman that have kids still to practice pathology.
Okay.
Part-time, working from home, taking care of the kids. The men also taking care of the kids with digital pathology. So changing the life quality of the people, permitting to access the profession. So digital pathology is also improving the quality of life of the pathologist to make an attractive profession.
I understand, but why? We see so many advantages of digital pathology. And you say even in Switzerland, which is considered in our brain to be like top level rich country, you still are below 20%.
You know, there is never a gain without pain.
It's like Arnold Schwarzenegger told
But,
that. No pain, no gain.
The point is, pathologists are conservative doctors. They don't like to change their habits. It's hard to change their habits. They think, I did it 20 years like that, it will be the next 20 years. It doesn't work. And the point is, I've been involved in digital pathology since 20 years.
Okay.
At the beginning, it was at the infancy. It was difficult. But now it's smooth, it's getting. And if you look also around yourself, look at the speed of development of the chip.
Okay.
Or, the computer technology is like every year doubling.
Something goes double.
So it's getting faster and faster. The kids, 2 years old or 1 year old, they're already with their tablets.
I don't allow my small kids.
It's okay. It's an attitude. But it is more and more improved. So it is affecting. And we are facing also an older generation of pathologists. They don't want to change. That's why it's difficult. And also there is the other pain are the cost. The cost of implementing digital pathology.
Yeah, but it's one-time cost, and then you save time and money once you implement it.
You know yourself, It's not because you buy a scanner that the scanner is the solution.
Oh, scanner is small. One, I would say, piece of sand on a beach.
Yes, you have the IT implementation. You have the support of the
authentication.
You have also the data centers.
Absolutely.
You have the upgrade of Windows. You know, you don't end up like with the Aeroflot that has been hacked because of Windows 7 software. Huh? So you need to have updated.
I know a story worse. I know recently Japanese banks failed and their software update was on diskette.
Yeah,
you remember these diskettes?
Yeah. So the point is, because we are touching cancer diagnostic of patient, there is a whole issue about data safety, and there is a cost associated to it. You said, and when you have a paper where the pathologist write on a piece of paper, it's much easier. As soon as we integrate in a computer system, it looks easier, but from a technical point of view and from an IT security point of view, it's more complex and is associated with cost.
Okay.
So that's why it's not so easy to implement.
And tell me, please, how digitalization of pathology grew in European Union when it started?
Well, it started in the you catch me here. I think in 2000 it started in the year 2000 slowly,
and
but
for 25 years we still have.
But it really started, I would say, a good 10 years ago with some companies that really started to do. But the full integration now that we are seeing, I would say, is about 5-6 years ago. You have university in Switzerland. They are fully digitalized.
Wow.
Fully digitalized. And now the young pathologists don't even see a microscope.
So they go fully digital from the education.
Okay. But again, the complexity of digitalization pathology is even more complex because you have the patient data where the X-rays are there, where you have the pathology diagnostic, where you have the AI. And it's about integrating those data.
There is nothing available in this world at the moment.
And there are some solutions available, but it's a complex thing.
Absolutely.
So it's why it's complex and why it takes time. But it's feasible.
I want to explain a little bit to our viewers what Dr. Pierre means. Dr. Pierre means that if you go to fully digital from looking to the microscope, you have a lot of procedural things, like you have to connect the devices, you have to differentiate the difference between the glass and the screen, you have to learn how to share data with your colleagues and things like that. So it's a complex process. It's not just getting the glasses scanned and that it will work tomorrow. No. And the other point that Dr. Pierre is trying to explain us, and this is not very, I would say, applicable to Ukraine, that he is always pointing that it's a patient, it's not his or her glasses. There are also other medical records that have to be accessible to pathologists, correct? And this is what we are working on. Tell me, please, about second opinion. Why it is important and why you say more and more about that.
I mean, in our institute in Switzerland, we have the policy that every cancer diagnostic is confirmed by a second pathologist.
Okay, why?
Because, first of all, it's a bad news to announce, and we better sure that we are sure.
Okay.
And also because as soon as you put the label of cancer diagnostic, you start to implement the whole chain of treatment, and chain of treatment mean change of life of the patient and cost. It's not the nice size of it, but the health insurance, they see the cost.
Of course.
So we need to confirm in order to be able to, because if you diagnostic a melanoma, the cost is not the same as an AVI, different cost.
Absolutely.
So it's why the second opinion. What we do in the institute that are non-digitalized, the pathologists, they go from one office to the next office and they say, what do you think about that case? And
You mean with physical glasses?
yeah. And
Okay.
they say, what do you think, John, about this? Is it a melanoma? What is the grade? Yes, it is. And the digitalization allows clearly to digitally refer the pathologist digitally to ask the colleague.
Okay.
It also allows when you are a smaller team, because mostly smaller team. In small team, you have, I would say, subspecialties.
Okay.
Someone that knows better the lung, the other
The
one.
brain, the prostate. Yeah.
Yes. And then when a guy make a diagnostic and the person is either on vacation or either in a conference, you send him a link and say, what do you think about it? Do you agree? Yes. So we improve the quality of the diagnostic. Second opinion mean also that if, for example, a good pathologist is a pathologist that knows that does not know everything.
Okay,
And
for
that
sure.
he knows his limit.
Yeah.
And to know his limit, you have to say, I'm not sure. And then I need to send a referral. And the referral, time to time, you have what you call center of excellence, where you have pathologists that they have subspecialty and they are expert. And then you can send this information to those experts and they give you your final diagnostic. If you send the physical slides, in Switzerland, it takes you like 1 week to have the second opinion.
But it's pretty fast.
Yeah, we are under pressure of TAT in Switzerland. We deliver our diagnostic within 24 and 48 hours.
Very nice.
Okay,
Very nice.
it's very nice. But nevertheless, time to time, cases are complex.
So you have to do...
We have to ask several opinion. It takes more time.
Maybe you need to make sometimes new grossings.
Yes, new
That happens as well?
More immuno or molecular analysis is also happening.
Okay. Tell me, please, so your lab was digitalized probably 10, 15 years ago.
No, few years ago.
Few years ago. Okay. Okay, still, it's done. And it's done few years ago.
It's partially done.
Oh, partially. Okay. Okay. But still, I want to ask a question. What did you achieve by that?
I mean, we achieve a better workflow.
You mean faster? You mean more... What?
Faster, easier. We achieve also to recruit more pathologists, young pathologists. They will look for to work.
Distant diagnostics?
Not only to work in the lab.
Physically?
Because if you are employed 100%, you work 5 days a week.
Yeah.
And in your contract, you can work 2 days a week.
Oh.
In the lab and 3 days from home.
Which attracts people.
People.
That's what you started from.
Yes.
Oh, okay.
We need to create this environment. It affected it. And also, digital pathology is not only the fact to look at slides on the screen.
But?
It's to get data from the slides. And if you want to apply AI protocol, you need to digitalize.
Yes.
So product of digital pathology is the application of AI protocol.
Yeah.
So what we achieve is to apply AI protocol, for example, in prostate cancer. The Gleason scoring works extremely well using AI solution.
Yeah, absolutely. I totally.
There is a very famous exercise between the pathologists. It's like a well-known sport. If you send a pathologist a biopsy, and he will say, yes, the Gleason score is 3 plus 4. Okay? Then you will send a second opinion for, at the university, and he will say, the pathologist, no, it's 4 plus 3. It's a sort of a...
But does the second opinion doctor see the first opinion?
No. But
it's blind.
Yes. No, but the point is when we ourselves, we have second opinion, 2 pathologists plus AI in the prostate biopsies.
Okay.
Which make the discussion non-discussable.
Okay.
And it also, AI can also help to train you, because, for example, the Gleason scoring remain a very subjective scoring, very subjective. So AI add a level of objectivity in the diagnostic.
I got you. I got you. Totally understand. Let's look a little bit into the future. What will be the cancer diagnostics, how it will look in 5 years? There will be a blood test, then molecular tumor profiling, and then an injection that will cure.
I think there will be more and more molecular markers available, that will be much more and more available. The blood tests are already there, especially to monitor the disease recurrences. You have very nice molecular analysis to see, do I have to apply a new chemotherapy, for example. How it would look like, I think if you look at, for example, at dermatopathology, now even technology is getting more and more that AI recognize the nevi as a cancer.
By making just pictures.
By pictures.
On the mirror, yeah?
Yes. Okay. So the pre-diagnostic will improve much more. Then the pathologist will have probably more targeted diagnostic to get.
I see.
So this, we will not be away from this process. It will come.
So it means the death of digital pathology?
No. It will be more and more digital, but the point is that it will be perhaps less biopsies because the AI will have detected the lesion earlier, But I think it's when you live in a very civilized country, then the doctors say it's not good because it's going to take my job, etc.
Oh, don't worry, doctors. There is a lot of job to do here.
Yeah, but the point is, I take the example of Switzerland. If I want to go to a dermatologist because I suspect that I have a skin tumor, it's going to take me 4 months to get an appointment. 4 months before.
In Switzerland?
In Switzerland.
But in Ukraine, I can go today.
Yeah, but not in Switzerland and not in other countries. Because, there is a lack of specialties.
Dermatologists as well?
Yes. Dermatologists, they don't do tumor diagnostic. Because it's not lucrative either. They prefer to do beauty treatment.
Of course.
That's the issue. And then, so therefore, the AI permit a certain access to medicine earlier that even a general practitioner can refer earlier to the... So it's a better triage of the patient.
Dr. Pierre, please imagine you get top power in Ukraine. What would you do first?
Power in Ukraine?
Let's say you have a magical wand and you can implement everything you want in Ukraine.
Yes.
How would you start changing the pathology, but how would you change the medical care and the healthcare system? What would you start from? This is what I want to ask. What is the number one thing needs to be done?
It's a big one. Big question. First of all, I would assure that the Ukrainian society or civil society is well protected, that you are safe. That's number one. That's important. And it's not the case at the present time. Unfortunately, it's unfortunate.
It is, but let's go more and more to medical.
Yes, but with the war, it's a very complex situation. So from the medical, what I would do, I would really focus on education. I would really
students, school,
and also university, specialty, etc. I will do that. I would also improve, I would say, the prevention process. Prevention process. Going to certain disease. You have some disease, and so
first of all, educate people.
Yes. So that a part of the budget should be dedicated for the education and prevention. Because we don't want to get a lung tumor on the table. We prefer that there is no lung tumor. Then education. Then also, when I was visiting some lab in Ukraine, if I speak about pathology, I think there is. I think I've been visiting 20 labs in
Okay.
Ukraine globally now until now, and it's a black and white society. I mean, there is a situation where it's a very poor stage, like about 40, 50 years ago,
Okay.
and there are labs that are really up to date. So we need to bring, I would say, a common level of standard in the lab in pathology, because it's nice to digitalize, but if you put your slides on a piece of wood, it will never be possible to put in a scanner.
Absolutely.
So to bring, I would say, the basic care of pathology to a certain level, standard.
But it will take 5 years, at least.
It will take a long time. You have a program of reforming the pathology up in Ukraine about 15 years on the investment. The point is, I don't know the numbers in Switzerland, in Ukraine, but I can tell you the numbers in Switzerland. Pathology in Switzerland on a healthcare cost basis represents 2.5% of the overall medical budget. 2.5%.
It includes molecular tumor profiling?
It includes molecular profiling.
Okay.
So it's not a lot on the overall healthcare process. It's very little. But that 2.5% trigger a lot of potential cost, because it triggers the chemotherapy, and the whole rehabilitation costs, etc. It costs a lot of money. So investing in early detection and investing in correct diagnostic support to decrease the cost of the medicine, possible cost of medicine.
No.
So that's what I would do, but it's a long program.
So we should not expect changes tomorrow.
No, you will. I think we need to get change now happening. And another point we need to work on is to make people not afraid of
getting to the doctor, at least.
Of getting the patient, yes, but also the pathologist not to be afraid somehow to open his world, to seek second opinion, to seek more education, to collaborate with the colleague, and that when you get the group working together, it's already better, because I met several pathologists here in Ukraine, and you have a good group. They're a very good group of people, but it seems that they
don't communicate.
They don't communicate. And this is like, losing a part of the value.
Absolutely. Totally agree.
And it's not about...
it's not about pathology only. I think medical doctors have to talk to each other.
Yes, and it's not even a part about competition, lab A, B, C, and D. It's about of improving the quality. And you can be working in competitive lab, you can still work correctly together to improve the quality. This spirit, I think, is not here. And that we need to work on it, but it will come. And it will making the people not afraid of change.
Great words. Great words. I think we had today a beautiful conversation. I think we touched a lot of points that I didn't know personally. It was a big surprise for me. Hope for our viewers as well. I'm gonna invite you next time for more deeper discussion on changes, on real things, and probably we would invite other doctors, clinicians, pathologists here to have common discussion. As you said, we need to communicate.
Yes, would be my pleasure.
Thank you so much, Dr. Pierre. Thank you much for watching us.
See you soon.
See you soon.